Debbie, I have no idea. It's here.
That's all I'm saying.
Hi guys, good afternoon. Good afternoon. How are we today? We're going to get the boring stuff over at first, and then we'll get to some fun stuff later. All right, we're going to talk about quality assurance and performance improvement. The acronym is QAPI. We're all going to be done, okay? It stands for quality assurance and performance.
Yeah, I don't think your microphone's on.
They're working on it. Can you hear me?
No.
Hello?
All right. Now I'm really loud.
Can you hear me now? Okay, so quality assurance is what we have always done. And so now we're just adding to it with performance improvement. This is something that is mandatorily required by the Centers for Medicare and Medicaid Services, by our state agencies that are going to be surveying us. And it's something that I think that it's processes and systems oriented. With quality assurance, you measure standards for compliance. With performance improvement, you're going to continuously improve processes to meet the standards, and it's an emphasis on prevention rather than inspection. It's an emphasis on systems rather than pointing fingers at people or placing blame. It's looking at the system-wide problem and asking the 5 whys. In other words, getting to a root cause analysis as to why something happens. The attitude is more proactive, and you're focusing on resident care, and the responsibility is for everyone. So that's why we're having this in service today. So it's driven by data, and it's not subjective but objective. It's not somebody's opinion as to whether something is wrong. So we're going to look at baseline, and we want to improve the residents' quality of life and care. And this is actually in the language of the regulation that has been enacted by the federal government. And it includes members of all levels of the organization. That means everybody here. We always want to look at how can we better the system. And I want you guys to always be looking at how we can better the system and let us know what kinds of things do we need to be a part of, or what kinds of things can you do on your own. And it's using data not only to identify the problems, but also to identify opportunities to make things better. It's on building the residents' own goals, bringing meaningful resident and family voices into setting goals and evaluating progress. So what does this mean? It means that on a lot of our QAPI focuses, we're going to bring in residents and families to be part of it. We're also we're also starting a family advisors that are going to have a coffee clutch in the afternoon in the bistro and help families that are having trouble with adapting. We all know that we have several patients and families that are having trouble with their loss. Coming in here is a very big step. It's hard on a lot of folks, and I think they cope better when they have somebody else they can talk to. Somebody else that they can talk to that really knows how the system works. This is something that's been done for years in like the cancer centers and children's hospitals, and more in the acute care setting, but I think it's something that will work well here as well. And I have a couple of family members that have volunteered. We're going to put them through some training, but then that way the families and residents also have a voice in our quality. So the performance improvement project teams are areas like you guys were talking about communication. And some of you guys were on that team for communication. That would be a performance improvement project where right now there is kind of in the developmental phase. They decided what they wanted for the information at the bedside that would go on a clipboard with a screen for privacy, and how we could incorporate that into systems that we already have in place. So we're not recreating the wheel, But we are also providing the much needed information and communication that you guys need either at the bedside or in the kitchen. I really appreciated those guys. We had 100% participation in that. Everybody who said they would be there was there. And we had some really great feedback of doing that. So the root cause analysis is really kind of peeling the onion. I think we had an in-service before. Anybody remember the in-service on root cause analysis? A little bit? Okay, so it's on finding the 5 whys. So, you know, you kind of go to the old adage. So your grass is yellow at home. So why is your grass yellow? Well, because it hasn't get water. So why doesn't it get water? Well, because it doesn't rain, or you haven't ran the sprinklers. So why haven't the sprinklers ran? Because the sprinklers are broken, maybe, or the water was turned off, or you want to save water. Or you want to save water, that's right. So you get down to the nitty gritty, and then you figure out, okay, well maybe I want to replace the grass with something that's water-wise, right? Or I want to do something different. So you keep going into the 5 whys. So, but the reason the grass is yellow isn't because the gardener forgot to water the grass. It's looking at the systems. It's not placing blame. So, with QAPI, our 5-year goal is the Governor's Gold Seal Award. So we want this facility to be a Gold Seal facility. Right now there are only 5 facilities in the state that have the Governor's Gold Seal, and we want to be one of them. Right? What does it take to get there? First of all, we have to be a 5-star rated facility. Where are we now? We are a 4-star rated facility. Where do we need to improve? Well, there are 3 elements to the federal and state star rating system. On the quality measures, we're a 5-star. On staffing, RN, LPN, and therapy staffing, that's how they rate us, we're a 5-star. And health inspections, we are a 2-star. The reason we're a 2-star is that we need 6 or less survey citations for the year. That is the average for the area. Last year we had 10 citations, and that includes complaint surveys and our annual survey. And so that's, every time they come in here on a complaint, there's a possibility that they could cite us for something. These are our prior survey citations to make everybody aware of what they are so that we can be sure that if you see areas that we need to improve upon, we need to do a root cause analysis maybe on some of them. I want everybody to be aware of them. Dignity. Dignity is not pulling curtains, not covering up a patient when you see that they're about to be exposed or are being exposed. You walk by a room and you see a patient that's undressed, then pull the curtain or close the door. Correct peri-care, and that would be for anybody who is doing peri-care. That's wiping from front to back, not back to front. Confidentiality of medical records. If you have a chart, you're sitting at a table, out here especially when there's anybody can walk up, make sure you either close it, put something over it, turn it over. You don't want to leave it out so that just anybody can see it. Housekeepers, diet aides, anybody, if you see something laying out, just put a blank piece of paper over the top of it or rearrange it. That would be helpful. Lint traps, that's both in the rehab dryers and in the laundry. So we want to make sure that the rehab dryers, lint traps are cleaned often. Hood vents, that's in our community kitchens. We want to make sure those are nice and clean and let, I don't know who actually cleans those, but let somebody know if they're not. Interim care plans, we need to be sure that they're done initially. Behavioral monitoring sheets done. Medication errors, and that was on missing meds. Salad bar items not at proper temperature. We had milk that was outdated for the day before, and stained coffee pots. That's something we want to look for. Expired over-the-counter drugs and other items in med carts. Now granted, these prior survey citations are for the last 3 years. They're not just last year. So you know, but we want to look at them all. Incomplete MARs, weekly skin checks not getting done, good techniques with treatments, and admission packets being filled out timely. So what's the most important thing that we can do? Keep the residents and families happy so they don't call in complaints, right? That's it. and make us very vulnerable. Any questions about quality assurance and performance improvement? We'll be talking more and more about this when we do a lot more root cause analysis. We'll be looking at more performance improvement projects as we go along. All right, now I have, we all have anxieties and we all have stress. And I was reading actually an article in the Wall Street Journal yesterday, and it was talking about the great effects of deep breathing. So,
share with you 3 pranayama exercises that can relieve anxiety, worry, and stress. Now, chances are you probably don't pay a lot of attention to how you breathe every day. Am I right? I mean, most of us are way too busy with our days to even catch a deep breath sometimes. That's why pranayama is so essential for helping you to find moments of calm during the chaos. Pranayama, by the way, just means breath control. So let's go ahead and get started with pranayama exercise number 1, which is simply elongating your exhales. What this will look like is we will inhale together to a count of 4, and then we will exhale to a count of maybe 6 or even 8, if you can stretch out the breath for that long. So first, we will just practice 1 together. I'll count you through it. And then I'll let you practice on your own, and you can follow along as I breathe. So come to a nice, comfortable seat, preferably your hips above your knees, or if you're seated in a chair, that's great too. Rest your hands in your lap or on your knees. And go ahead and close your eyes. And then we'll take a big breath in through the nose, just even and easy, and big breath out, let it go. Now we'll inhale, 1, 2, 3, 4. Exhale, 1, 2, 3, 4, 5, 6. Inhale, 2, 3, 4. Exhale, 2, 3, 4, 5, 6. Inhale with that count. Exhale longer. Continue at your own pace. Make
what happened?
She went to sleep.
Breathing the body and forcing tons of breath out. Just simply work with what is available through your inhale and through your exhale. Take 1 more. And gently open your eyes. Just observe in that even short period of time, maybe how you've already started to shift. Moving on to the second pranayama, Kapalabhati. So this is skull shining breath. This breath is a forceful exhale while pulling the abdomen in toward you. So what I'd like you to do now is place both of your hands on your abdomen. You can place one hand above the other or right here on your abdomen. And then gently press your hands in and let that breath come out through the nose. So feeling that belly come in and feeling that forceful exhale come out through the nose. Now what we'll do is we'll take 10 rounds just focusing on that exhale. We'll fill up with an inhale and then we'll exhale, 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 about 1 exhale per second. So don't worry if you don't catch on at first. This is a little bit more, requires more awareness of pulling the abdomen in to send the breath out. So once again, close your eyes. We'll take a big breath in. Now exhale, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Deep breath. And follow along. Another inhale. Exhale. Inhale, nice and deep, and watch the hands down. And exhale, nice and deep and even. Open the eyes. That was interesting, huh? Sometimes it's hard to find that pole, but usually by the third round, you're able to settle into the breath. That is great for increasing mental clarity, clearing out all the thoughts. You may even feel a little bit more lightheaded right now. Our third pranayama exercise is Nadi Shodhana, and this is alternate nostril breathing. We'll begin by taking our right hand up and press the first finger and the middle finger into the palm, and then match the ring finger open with the pinky, and the thumb will remain open as well. If it's not comfortable for your hand, you can simply open up through the pinky. But this is the more traditional way, and you're moving the breath. And close off the right nostril with the right thumb, and inhale through the left. Now close the left with the ring finger, exhale through the right. Gently close the nostril, exhale left. Now close the eyes, inhale left. Close, exhale right. Inhale right. Close and exhale left. Inhale.
What's your... You pick it up. They're cracking us out,
Last round on your own. Inhale. Finally, exhale out the right nostril, bring the hand down to the left. Inhale through both nostrils, and exhale through both nostrils.
All right. So what I read in the Wall Street Journal yesterday, does anybody know what numbers to treat? Does anybody know what that means when it's related to a drug? The department has to, because they had it in our morning meeting the other day. So numbers to treat means that every drug that it goes out in the pharmaceutical industry has a certain number of people it has to treat before it's effective. For the most popular drug out there, a statin, takes 300 numbers, 300 people has to take that drug before one person has the benefits of that drug. It is crazy. Look it up. Look up the numbers for your medications. So when I read in the Wall Street Journal that this incredible study was done, and these people did deep breathing for 30 days and brought their cholesterol numbers down, and their numbers to treat was a whole lot less than that statin with all those terrible side effects. And I said, well, maybe I should deep breathe every day then. But it was proven that it lowered blood pressure, it brought blood sugars more into the normal range, and of course there's a whole bunch of things because people just don't breathe, don't take in the oxygen that they need every day and let it out. That we don't take the time to take a minute and step back and relax and breathe deeply. So see if I see you in a chair sitting down, just tell me you're breathing deeply, okay? That's right. Okay, last but not least, here's our last slide. So somebody tell me about the slide. Dice, okay, so tell me, describe the slide for me.
Exercise for concentration.
It's an exercise in concentration. No, what is it? Describe it.
Four circles and a white background.
Okay, he talks about the white background. Okay, so we have 4 black circles. What else? Anybody else want to tell me about it? Okay.
Black background.
Okay, they don't touch, all right. All righty, so this was kind of, a professor actually gave this to his students in the classroom and said this is a test. And you have to write about the black dots in the center. So and everybody in the room wrote about the black dots. He just asked them to write an essay about this piece of paper. And they all wrote about the black dots. And he said he just wanted to give them something to think about. That no one wrote about the white part of the paper. Everyone focused on the black dots. And the same thing sometimes happens in our lives. However, we insist on focusing only on the black dot. The health issues that bother us, the lack of money, the complicated relationship with a family member, the disappointment with a friend. The dark spots are very small compared to everything we have in our lives, but they're the ones that pollute our minds. Take your eyes away from the black dots in your lives. Enjoy each one of your blessings, each moment that white life gives you. Be happy and live a life filled with the white.